I'm Dr. Hurst with Joint Implant Surgeons, and today I'm going to talk about the patient experience for outpatient joint replacement. Even about 5 to 6 years ago, most joint replacements across the country were done with a minimum 3 to 5 day hospital stay. At Joint Implant Surgeons, we have pioneered a program to get patients home the same day. I'm going to take you from start to finish, from entry to the center to discharge, and you'll see what it's like. Most patients arrive to the center about an hour and a half before their scheduled surgical time. Upon arrival to the center, the patients will come right here to the front desk. They'll present their insurance card, go over paperwork and some logistics before they then go back to the operative suite where they can have their preoperative evaluation. Once you're finished with the front desk, you'll be then escorted into the clinical area and brought here to one of the preoperative holding bays. Here in the holding bay, you'll meet your nurse and your anesthesia staff. The first thing you'll do is you'll be given a patient gown and an IV will be placed. At this point, you'll be able to ask questions about the surgery, and most importantly, you'll be asking questions about your anesthesia for the surgery. They'll go over these in detail with the anesthesiologist, and you'll also have a chance to talk about your surgery with your surgeon. They'll meet you here, go over the consent, and then get you ready to go back to the operating room. Once you enter the operating room, you'll be greeted by a whole new host of staff members, including operative techs and OR nurses. The typical operative time for a joint replacement is about an hour. But you'll be in the operating room for about 60 to 90 minutes for prepping, draping, and emerging from anesthesia. Once the surgery is complete, the nursing staff from the operating room will take you directly back to the same preoperative holding area where you'll start phase 1 of recovery. Once you arrive here to phase 1 recovery, the main responsibility is to make sure that your pain is well controlled, your nausea and vomiting is controlled, and that you emerge from anesthesia safely. Once your vital signs have stabilized, you'll then be moved to phase 2 recovery. After you spent about 45 minutes in the first phase of recovery, you'll be brought here to the second phase of recovery. Here you'll meet another nurse who will take care of you during that time. You'll also meet your family members, you'll start drinking and eating something, and then you'll also meet a therapist who'll get you up walking for the first time just 2 hours after having had your joint replaced. We'll then go over all the discharge paperwork, and once everything is under control, we'll be able to get you home. Most patients spend about 2 hours in the second phase of recovery. Once they've gone through those 2 hours, they're usually ready to be discharged. And if you think about the time, it's only been 6 hours since they got to the center and they're ready for patient discharge. Here we are back where we started, and that was the experience of a typical outpatient joint replacement. Visit our website at www.jointimplantsurgeons.com if you have any questions, and I'm Dr. Hurst, and I look forward to treating you in the future.